Welcome back to Politics Done Right. Politics Done Right made a promise. We were going to be talking Medicare for all ad nauseum. And the reason why is because there are those opposers out there who are opposing it for reasons other than your health,
right.
for reasons other than what is best for you.
Yep.
So today I'm with Dr. America. And by the way, Dr. America was that guy that you saw on stage with Bernie Sanders and I think with Jayapal as well for the Medicare for All bill. His name is Sanjeev K Sriram. He's a medical doctor. He knows what he's talking about. And I think today we are going to have a great talk. Please listen. Please share. This is existential. Your life depends on it.
That's right.
Dr. Sriram.
Good to be back.
I mean, it's great having you. It's great. It's been wonderful watching your tweets.
Oh, thank you.
Okay, because they are important. They were informative. There are times that I got it and I said, I guess I need to go do that now. So thank you for what you're doing for the movement.
Thank you.
Please explain to us again. Look, what we've learned is that repetition is important.
Yeah.
So what I'd like you to do, in short, is to first tell our audience what is Medicare for All.
Okay. So Medicare for All is a new way of paying for healthcare. It does not change what your doctor will be doing for you when you have an illness or when you want a checkup or when you need help. The healthcare that you're getting is going to stay the same because that's science, it's medicine, it's, we go to school, we have training, we are going to follow those ethics and practice that science. What is going to change with Medicare for All is how we pay for the services and what we prioritize in our financing of healthcare. So right now when you go to the doctor, your doctor's office has a ton of fragmentation with their pay. You've got doctors who have to, contract with insurance companies, with Medicaid, with Medicare. They have to, figure out whether they're going to take cash payments from patients who are uninsured. And then every year, the insurance industry will change contracts. And the doctors will kind of have to look at those contracts again to decide, you know what, I can't work with this insurance company anymore. And that's how actually a lot of Americans end up losing the doctor that they really like.
Right.
It's not because of anything that the ACA did. It has nothing to do with what any politician did. It's that the insurance company keeps messing around with their relationships and contracts with doctors. And so doctors slip in and out of network. And so that's what is messing up a lot of what patients experience at the doctor's office. So what Medicare for All does is that it tells the doctors, focus on taking care of patients, not paperwork. Mm-hmm. We're going to pay you properly, on time, for the work that you do. You are not going to be wasting time haggling with the insurance industry to get paid for work that you have already done.
Right.
That's actually something that I keep repeating to my medical colleagues is that, for those who have hesitations about joining the Medicare for All movement, I tell them the average American doctor is losing 3 weeks of every year to fighting with insurance companies to get paid for work that they have already done.
Right.
That is 3 weeks that no patient is getting healthier. No doctor is making money off of that. The only person getting richer during those 3 weeks
the insurance executives.
is the insurance executives. It has nothing to do with
healthcare.
Public health or making patients' lives better. And so that is what we have the opportunity to dismantle. And what physicians want to do with those 3 weeks, that's up to them. I'm not going to tell them what to do.
Right.
If they want to see more patients, great. If they want to do some, take some time to do some special skills training and education because there's always something new in science and medicine,
do it.
Do it. If they want to spend more time with their family and avoid burnout, do that. But there are so many different things that you can be doing as a doctor with 3 weeks that is better than fighting with the insurance company. And so that's what's in it for physicians when it comes to being in Medicare for All. For patients, right now, when a patient in America wants to figure out healthcare, how am I going to go to the doctor?
Right.
They have to clear so many hurdles, right? Well, what do you make? Well, how much money do you earn? Where do you live? Because depending on what state you're in, your state may have expanded Medicaid or not expanded Medicaid. Mm-hmm. Plus, your insurance decides what networks they're going to work with city by city, state by state. oftentimes they're going to ask, "Are you a citizen? Who do you
Right.
look? What do you look
Right,
like?" I
right.
mean, a lot of these questions, instead of just answering the person's question of, "Here's the address for your local doctor's office. Now let's help you figure out a way to get there."
Exactly.
That's what Medicare for All is going to be for us when we actually build this thing.
No, and there's no reason for that. I mean, they like to promote the word competition. The reason we want several insurance companies is we want competition. I think that's the worst argument, in that they're assuming that paying a bill is a product.
Right.
How do we dispel that notion that paying a bill isn't the product?
Right. I mean, and also let's also dispel the notion of competition, right?
Right.
Because a lot of these insurance companies have, like, when I started medical school, there was maybe the top 12 insurance companies. That became like the top 10, then the top 8, and now we're down to 5 insurance companies because of mergers. These guys, these are huge corporations. They care about their dividends. They care about their shareholders, and they care about merging and increasing market power for profits. Nowhere in any of that does patients or healthcare actually fit into their priorities.
Again, the reality is, and please tell me, there's not, insurance companies, the only service that they provide really is to manage risk. And if you have one risk pool, there's no risk to manage, right?
Right. So what they're really also trying to do is that the way that an insurance company makes money is by denying you care.
Right.
Because they, every month that you pay premiums, they want to hold on to every single one of those dollars.
Right.
And the moment you go to the doctor's office, now the insurance company has to pay the doctor's office.
Right.
So the more that they're able to deny,
the more they make.
That's
their method.
And so that, again, it has nothing to do with optimizing your health.
Right.
And left to these insurance companies, if the ACA is gone, and if everything that happened in the Fifth Court of Appeals and everything like that, they don't mind going back to the time where they can use your own body to discriminate against you.
Right.
Saying that, oh, you have cancer now, and that's really expensive.
Right.
But when you first applied for that insurance policy, you didn't tell us that you had acne when you were a teenager.
Right.
You were dishonest.
Right.
Acne is a pre-existing condition, and you failed to report that.
Right.
We're rescinding your entire policy, and now we don't have to pay for anything.
Anything whatsoever.
Now, that's what they used to do before the ACA. The ACA outlawed that. But the fact that was ever, a business model, the fact that was ever a protocol or practice, tells you that that patients have never been a priority in healthcare for them.
Now, we are deep into the election cycle.
Yeah.
It seems like Medicare for All, the buzzwords on.
Yeah.
Does it really mean everything to every single candidate?
That's a good question, and what I'm looking for are the journalists who have taken the time to understand what the bill is.
Right.
Because when I saw that question asked in both debate nights about, do you support abolishing private insurance?
Right.
I felt that it was a very misguided question. Because that isn't the goal of Medicare for All.
Right.
The goal of Medicare for All is to make healthcare a basic human right.
Exactly.
And what we're abolishing are the false choices that millions of patients and families make.
Exactly.
There are millions of patients and families right now.
Right.
And I'm talking about the people with insurance. Over half of us who have employer-sponsored insurance have family members who are avoiding going to the doctor because they don't want to pay for the cost.
Right.
Isn't that the whole point of having insurance?
You wonder why it is that the message doesn't go over, and we know why. We get mixed messages from corporate, the Partnership for
America's Healthcare Future.
Okay.
Yeah.
They have psychologically well-designed ads like the Lucy. Remember the
it's
the Lucy and Mary or Louise.
Yeah.
Commercials. I try to tell them, oh, you're going to lose your coverage. You're going to lose this.
Right.
Now, what I really think we need is a lot of doctors in their white coats coming out of the weeds and saying we would be much more efficient without these healthcare companies, the health insurance industry.
Right. I mean, it's 3 weeks of the year that we would be spending with our patients, that we would be becoming better at what we do.
Right. I think I asked you this question before, but why is it that more doctors we don't find supporting the
So, I mean, doctors are as vulnerable to the messaging of industry as anybody else, right? I mean, like, doctors like to kid themselves that, oh, pharma doesn't, have an effect on, like, what I prescribe, and the insurance industry doesn't have a grip on me. But then you turn around and look at, like, what are the top 10 most prescribed drugs in America?
It's the
top 10 that are most marketed, right?
Sure.
So, it's sort of like, I mean...
correlation.
Right. I mean, like, physicians are no different, or, like, they're not that much smarter than the average American when it comes to handling how industry, deals with propaganda and all of that.
Right.
And so as physicians, we have to really be honest with ourselves about those 3 weeks that we lose every year. That's money that is lost, $83,000 per physician practice.
Right.
So whenever people say that, oh, like, I can't survive on Medicare rates, what I tell them is that, like, right now the insurance industry has tricked you into thinking that they are paying you more.
Right.
But the moment you have to pick up the phone to haggle with them over getting paid, you're losing money.
Right.
And so your pay is being lost, and your time and effort is being lost on paperwork when it should be with patients.
Right.
Isn't that why we all went to medical school?
Yes,
And so these are the conversations that we have to be having as physicians. We have to be, like, reconnecting with what is it that made us want to do this work in the first place. And honestly, the future of the country really does depend on us creating a more sustainable healthcare system.
Exactly.
Because, I'm sure that that the majority of this country will be minority.
Yes, and pretty darn in the next 30 years or so.
It's actually much sooner than that. As a pediatrician, I can tell you that our child population, so babies under age 1 became majority minority in 2011. That was the first year that babies under age 1 became majority minority.
Wow.
Well, since the arrival of imperialism.
Yes.
But then, like, in the 2014-2015 school year was the first school year in public schools where minority students outnumbered white students.
I didn't know that.
Next year, 2020, is the first year that everybody under the age of 18 will come from a minority community.
Wow.
So we are rapidly becoming a majority-minority country. It's not some distant milestone. It's happening now.
No wonder Trump is freaking out.
Oh, of course, right? But the thing is that a lot of these kids, like, they are also dealing, like, not only are they dealing with racial inequality, they're dealing with income inequality.
Right.
The two are, like, so tightly linked.
With that inequality also comes health inequality.
Right, because they can't afford any of what the insurance company is charging them.
Exactly.
I have patients where they are graduating out of my practice. I see people who are, like,
18,
about,
right?
well, actually till mid-college.
Okay.
And so they're in the middle of college or looking at, like, their first job coming out.
Right.
And I have had patients say that I can't take a job in a southern state, even though it would be a great opportunity because I need Medicaid coverage. And so they're going to go for, they're cutting themselves out of a potential really great job opportunity because they have to look after their health.
And many times these are the people who vote for those guys.
And the scary thing of it is that, if we don't tell the truth to ourselves, this is going to become a healthcare system that really reflects apartheid.
Exactly.
Where if you are white and wealthy, you get to be healthy, and if you are not, then you are not just poor, but you are sick and poor. Right.
Well, let me ask you, what do you think about Jayapal's bill, Representative Jayapal's
I'm a strong supporter of Congresswoman Jayapal's bill.
And how do you think it compared to what was formerly HR 676, which is now something else?
So I think that actually it added a lot of meat to those bones.
So you think what it is it actually defined these different things as far as it's concerned?
Oh, absolutely.
Yeah.
In fact, I would say that the ACA, I mean, like, where the ACA was at this point 10 years ago, and where Medicare for All is now, like Medicare for All in HR 1384, Congresswoman Jayapal's bill, it is a far more robust bill than what the ACA was, like, at this point in time 10 years ago.
It's interesting because they were concerned that because a lot of it was written sort of out of sight, that it would have been problematic, but it looks like it turned out much better than people thought it was going to be.
You know, the whole thing about it being written out of sight, I felt that they were inviting people to come and meet with them so that they could hear them honestly.
Right, okay.
And so and the thing is, like, a lot of people who are vulnerable
right.
they can speak their truth more freely if they are free of the worry of, am I going to get blasted in public for speaking about the truth of my vulnerability.
Right.
And I feel like the bill right now, it reflects a lot of listening that has happened from one community after another after another. Like, the disability community did a powerful job of making sure that there are provisions that allow our brothers and sisters with disabilities to get services at home in their communities and not be institutionalized. And that's in the Medicare for All bill.
Did I hear that we're one vote away?
So we are
Democratic vote away?
We are one Democratic vote away from having half of all the Democrats in the House co-sponsoring Medicare for All.
When that occurs.
And when that occurs, it'll be a lot harder for the House leadership to deny hearings, to eventually bring this bill to the floor of the House for a vote. Because what I love telling people is that we want to move the Medicare for All curious to Medicare for All committed.
Exactly. I had two Medicare for guys from the Nurses Union come and talk about that. Now, in closing, give me a direction.
Yeah. So August recess. Mm-hmm. Okay. So Congress takes a recess in August, and they go back home to their districts and states where they have town hall meetings, and they meet with their constituents. It is a great time to talk to them about Medicare for All. If your representative is already a supporter, great. But remind them that this is a racial justice issue. 59% of America's uninsured are minorities. And so we need Medicare for All as a racial justice initiative just as much as we need it for health,
social justice, health justice.
Right. And so, it builds a sense of urgency in a supporter to to help them reaffirm their allegiance to Medicare for All. For those who are, like I was saying before, curious but not yet committed, it's a great time to meet with them and talk about, well, what do the current uninsured look like in your community? Bring those stories, talk about that vulnerability, that pain, and what Medicare for All can do. Mm-hmm. And for those who are opposed, let them know that, 2020 is an election year.
Right.
Time is ticking.
And that we'll take care of them then.
That's right.
Dr. Sriram, did I say that right?
That's right.
Thank you so kindly, Dr. America, for being with us.
Absolutely, thank you.
And by next year, we hope to meet where we're going to be even more positive on Medicare for All.
Yeah, then we're going to be talking about how we're going to fight the Senate to get this thing passed.
Exactly. Thank you so kindly for being with me.
Oh yeah, thank you.